Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC of Gold Midwifery 2015. I'm chatting today with Karen Strange about her upcoming presentation titled The Baby's Experience of Birth and Tools for Healing and Integration. Welcome, Karen.
Thank you. It's very nice to be here.
Well, we're very happy to have you here, and I'm really looking forward to your presentation. Really interesting topic. And the first question I have for you is really, what led to your interest in exploring the baby's experience more closely? We're so used to talking about the mother's experience of birth, so I'm wondering what led to you wanting to explore the baby's experience more?
Well, it was really, I was trying to explore what was going on inside me and from the trainings that I had done and all the births I had gone to when I started to have a home birth practice. And I really ended up doing a birth workshop where you get to explore some of your own early experiences. And there was a portion where you got to see people doing a piece of their birth. And I remember as a midwife, as somebody that knew birth very intimately, I began to see people experiencing and expressing what it was like for them, and just saw, I don't know, it was about 28 people that were doing this little process, which I'll go into in my lecture, but it dawned on me that I'd never really heard this before. Nobody ever talked about it. It wasn't in any midwifery training or medical textbooks about the baby having this memory. And what I soon learned was that the reason we don't talk about it is because we have implicit memory in our early days and weeks of life. And implicit memory is a cellular memory. It's the memory that we have in our body. It's not the, oh, I remember that kind of memory. That's explicit memory, and that comes online around 18 months of age. But when I was at this workshop, seeing person after person experience pieces of their birth, it was catastrophically shocking to me that I did not know this. And I thought, oh my goodness, if this is what's happening, imagine a resuscitation. And it really was from that point on that I changed how I lectured, and I became driven to find ways to teach this material, to help people have an understanding of what the baby experiences at birth, and then more than that, not only talk about that, but give them tools to help babies make sense of what happened, to help babies integrate what happened, all the time, but especially when there's been an interruption or an intervention, which really happens more often than not. And so that's what I do. That's my big drive and my big interest, to show that the baby is having an experience which could be completely different from the mother's experience.
Really interesting. Thank you so much for that. And it really comes across when you're talking, just your passion, and it was obviously a very profound experience for you. So thank you so much for sharing that. The next question I have for you is, you're obviously very passionate about this topic, and I love that. So I'm just wondering, what are you most excited about sharing with this presentation? What are you really hoping for people to take away from this presentation?
Easy question. Well, I guess the bottom line is that babies are conscious, sensitive, aware, and laying down memory of what happens to them before, during, and after birth. And so my real goal is to help people how to be with babies and how to see babies. And then again, always tools for what helps babies when things don't go as planned. Because life is filled with stressors, right? You know, we sometimes have car accidents, we have fight with our partners or our friends, people die, things happen. Life is filled with stress. So it's not really about living a stress-free life. It's more about what helps babies, which in turn become children, which in turn become adults, integrate what happened, heal what happened. So that's my excitement and drive, is to help people see that it starts from when we're babies, but it's true of children and it's true of adults.
Wonderful, thank you. And I love that, one of the things you're going to be doing is giving tools, because I think it's, all of this information is so fascinating. And a lot of times, we hear all of this really interesting information, but then we're left with, okay, how do I apply that to my practice? So I love that you're going to be giving us tools for, how we can actually go out and apply that when we're practicing. That's wonderful.
So I'd like to add that when I first started talking about this, that's what happened, Flora. I would talk about it with my clients, and it just made everybody feel guilty. And I thought, oh, God, there's got to be a way to talk about this in a way that gives tools and doesn't create guilt. And so that's what I strive for. I think I do a pretty decent job, but it is a shift in perception. It is a learning. It's something we have to learn to be open to, even though I do think it's all ancient wisdom and ancient knowledge.
Wonderful. And I think it's one of those areas where, often there is a lot of guilt involved, but I think it's one of those times where we really have to remember that we all do the best we can with the knowledge and information that we have available at the time. And this is one of, as we learn more, then we can go out and we can do things differently. So I think that's fantastic.
Absolutely.
So I'm really curious. Then, what kind of feedback have you been getting from people who have taken your classes? What kind of results are they seeing as they take these things and put them into practice?
Well, I get lots of emails, and I have feedback forms that I get from all the classes that I teach, and usually people are like, whoa. Oh, I see what my baby's been saying. Or they'll write me stories about what happens when they talk with their children. In terms of resuscitation, people will tell me how much we're grounded and they knew what to do and how to do it. And it wasn't this big, scary event. So the feedback has been pretty good about the material and the information, creating that little paradigm shift. And again, as I said, it's, I make this about babies, but it's true of babies and it's true of children and it's true of adults. And these are all tools that we can use in communication and in relationship with each other, because it's when we're a baby where that relationship begins. So the results have been pretty darn good, and I'll get to tell you one of the stories in the presentation next week.
Fantastic. I'm really looking forward to hearing more about all of this, and I'm sure our delegates are too. So Karen will be presenting live on February 24th at 1900 UTC, and we look forward to seeing you online with us then.
Great. Thank you, Flora. I look forward to being there.